So we're often asked this, and to be honest, as clinicians, we don't really stage pulmonary fibrosis. We recognize that there are patients with changes on the high-resolution CT scan, but no symptoms. These patients, strictly speaking, don't have idiopathic pulmonary fibrosis or any sort of pulmonary fibrosis, but they have residual lung abnormalities, which we do need to keep an eye on to make sure they don't progress. But once you actually have a diagnosis of interstitial lung disease or pulmonary fibrosis, we recognize early disease or mild disease, and then moderate disease, and then more severe disease. And usually we define whether you are mild, moderate, or severe depending on your symptoms and your lung function and your imaging. But very, very crudely, if you have a forced vital capacity, which is one of the lung function tests, of above 80%, then we would say you have very mild disease. If you have a lung function forced vital capacity of 50 to 80%, then we would say you have moderate disease. And if your forced vital capacity or FVC is less than 50%, then we would say you have severe disease. And I think that's a reasonably good demarcation of the stages of pulmonary fibrosis. But unlike other diseases, you don't necessarily progress through the stages. You might have mild disease and stay mild, or you might very quickly progress to severe.